Hi, I am going to speak about the effects of aspirin for primary prevention in persons with diabetes mellitus. Definition: Aspirin is a medicine that has important cardiovascular benefits in diabetes mellitus, and therefore its use should be recommended at doses between 75 to 162 mg every day in secondary prevention for diabetic with a history of heart attack. The change in the relationship between diabetes mellitus and cardiovascular disease has been summarized in a few words. Diabetes has gone from being a metabolic disease to being a cardiovascular disease of metabolic origin. I believe in nursing. As nursing professionals, one of our duties is to promote health. So in this case, what we must do is teach diabetic patients the benefits of aspiring their illness.
Well, I think this is a very difficult question in a way because we have to really try to estimate the risk of patients with diabetes. As far as we know, the guidelines, practice guidelines are very controversial on this issue. There are guidelines who are very pro the use of aspirin in patients with diabetes, so in a liberal way, and other guidelines which are more concerned of the assessment of the risk. So patients with type 2 diabetes have a certain degree of risk, but within this category of patients, there are patients with a higher risk, and they for sure are entitled to have aspirin in primary prevention. We have tried to investigate in different trials. The most recent one, the Ascend trial, was trying to assess the importance of having aspirin in primary prevention in patients with diabetes, but still we are left over with this uncertainty because of the balance between the benefit and the bleeding risk, which is there. And so I think we have to have a conservative approach and try to dissect the risk of a patient to the best of our possibilities.
Application in Ecuador. The inclusion of all diabetics in aspirin prevention is due to the conviction that metabolic disorder is the cause of the greater frequency of coronary heart disease, cerebrovascular accidents, and peripheral arterial disease in diabetics, and it is debated whether the prognosis improves in the properly controlled diabetes.
Hi, I'm Dr. Ted Hudspeth, and I wanted to discuss aspirin use in diabetics. For diabetics who are at increased risk of having a heart attack in the next 10 years, which that actually includes most men aged greater than 50 and women aged greater than 60 years with at least one major risk factor, such as family history of heart attacks, high blood pressure, smoking, high cholesterol, or protein in the urine. If you are having any of those, then you should really be taking one baby aspirin a day. If you have a very low risk of having a future heart attack in the next 10 years, then we probably would not start it at this time. That would be if any of those previous risk factors that I just mentioned were negative. If you have had a heart attack in the past, then if you have no other major risks with aspirin, then you should at least be on a baby aspirin a day, and some cardiologists would certainly have you on a full 325 milligram aspirin per day. If you are not currently on any aspirin therapy and you are a diabetic, you should discuss this with your doctor and consider being on this for primary prevention.
Okay, now I will speak about the pros and cons. Pros. The efficacy of aspirin in secondary prevention and the extrapolation of results obtained from high-risk patients without prior cardiovascular disease has led to their recommendation as being extended to patients in primary prevention, such as diabetics. Cons. In patients with multiple risk factors and CVD risk at 10 years between 5 to 10% and individual clinical evaluation, it's necessary to decide the therapeutic approach they follow.
Here. I had a question recently about aspirin, okay? First of all, check with your doctor. I'm not giving you any medical advice for this. I'm just giving you some education and some other viewpoints on aspirin. Some people are taking it as a preventative measure for heart attacks and stroke that don't have any problems with their blood work or don't have any problems. They just want to prevent it. Other people do have problems and they're taking it. And some people are taking it for pain and inflammation, okay? So the thing that you need to know is that one of the side effects from taking aspirin is that it creates damage on the liver, especially if you take a lot of it. And it also creates internal bleeding. It also creates kidney problems. Okay, it's right on the label. You can just read that. Over 6% of the group of people who take aspirin end up hospitalized, okay? And 15,000 deaths a year in the US alone from aspirin. So it's not 100% safe. But people say, well, it's also not safe to be at risk for heart attacks or stroke. I understand that, but I just want to give you some alternatives to look at. If you wanted an alternative, you can check with your doctor to see if you guys can work out the, but make sure you check with your doctor to make sure that you both are in coordination. But cod liver oil is a very great oil for the heart, also to thin the blood naturally. It has vitamin A, it has vitamin D, it's good for the immune system, it's good for the cardiovascular system. If you wanted to get cod liver oil, I would search out a virgin cod liver oil. It's just higher quality, it's a little more expensive, but it's definitely worth it. Number 2, vitamin E. Make sure the vitamin E you get is a complex, a natural complex, not a synthetic like alpha tocopherol. You want to get the whole complex and make sure it's more of a natural version. Vitamin E also is great for the heart, good for angina. It's good for supporting a healthy heart, cardiovascular system. And of course, probably vitamin C too, to strengthen the capillaries and the arteries to help support your vascular system so you don't get a stroke. Vitamin E is very important. Make sure it's a natural food-based vitamin C complex, okay? Now the other thing is if you're taking aspirin for pain or inflammation, there's some other things that you may want to do to go deeper. Cod liver oil is a great anti-inflammatory. That's one thing. Number 2, stinging nettle root is one of the best natural anti-inflammatories that I know. And it's natural, it doesn't have any side effects, and it works really good for anything like arthritis and pain. I like this one. Also, intermittent fasting and keto. If you're watching my videos, you know all about this. If you don't, start watching the intermittent fasting and keto combination, ketogenic diet, because this will drop inflammation probably faster than anything that I know. Next thing, if you have gout, inflammation from gout or rheumatoid arthritis, you need a lot of potassium. Make sure the quantity of vegetables are between 7 cups and 10 cups a day. In addition to that, you might want to get a potassium supplement, maybe electrolyte powder, to really increase that to lower inflammation as well. All right? Thanks for watching. Hey, you probably already subscribed, but if you haven't, press this little button down below and I will keep you updated.
Now, the conclusion. Aspirin can be used as a primary prevention against diabetic mellitus. It is highly recommended since its effectiveness has been seen in patients with cardiac pathologies. However, a medical evaluation is always good to verify that it can be used regularly. Thanks for watching.